Well, it is my pleasure to introduce our final speaker for this section or segment of our program, Shannon Rego O'Rourke, the Research Director of All Stripes, speaking about SURF1 related Leigh syndrome health data insights. Take it away, Shannon.
Thanks so much, Danielle. Okay. Screen sharing working okay?
Yes.
Wonderful. Thank you so much. Well, I'm so grateful for the chance to present to you today. I'm Shannon Rego O'Rourke. I am a research director at All Stripes. I'm also here with my colleague, Erin Smith, who is a director of patient engagement at All Stripes. And she'll be here and available to help with questions later. It's such a delight to get to share some data that we've collected through our partnership with Cure Mito today. So I'm just really grateful for this opportunity. I'm going to start by just telling you a little bit about what All Stripes is for anyone who doesn't know. And then I'm excited to share, again, some data that we've been able to collect through this really exciting partnership. So at All Stripes, our mission is to unlock treatments for people affected by rare diseases. And we have been fortunate to be able to do this by partnering with organizations like Cure Mito to support the development of new treatments with data. So how do we do this? We've developed a two-sided platform. And that platform has a patient-facing side that many folks here may have seen if they're participating in our research. The goal here with the platform is that we are able to consent patients and families to sign up. They sign consent through our central IRB protocol, and we're then able to go and gather patient medical records on their behalf. We're also able to survey patients, and we're able to recontact patients through the terms of our IRB and our protocol as well. Our team goes out, we gather these records at no cost to families, and then we're able to structure that data and make meaning out of it. And that's the part on the flip side of the platform, what we're able to do in terms of structuring data and getting it out into the world to help advance treatments. We have partners, including pharmaceutical companies. We also have partners that we work with, including folks at research institutions. So we're always looking for ways to get more data out there into the world. And that data can be for the purposes of supporting FDA submissions. It can be natural history studies. The goal really is to support in any way we can meaningful research that can help advance treatments. So again, all kinds of data exist in patient medical records, which are one of the sources of data that we collect in addition to surveys and other sources as well. I'm sure lots of folks here have had the chance to dig into their own medical records in the past. So when we are able to gather that information and really structure it, we can learn so much about what the natural history is of a condition, how are patients initially presenting, how are they actually getting to that point of diagnosis? What does that typical diagnostic journey look like? And then once a patient's actually diagnosed, how are they being managed? Is there like a standard of care that we're seeing emerge through records? How does the condition progress over time? These are all some of the questions that we are able to dive into with the benefit of this real world evidence in the form of patient medical records. So how that works is we at All Stripes support many different conditions, all rare conditions on our platform. And we support these conditions in partnership with amazing organizations like Cure Mito, who help us recruit patients to sign up on the platform, and for whom we then are able to gather medical records that the patients are able to access on our platform. Patients consent through the platform as well. We're able to retrieve those records, and we're able to also update those records over time and share that data out ultimately with our partners. So we've been really fortunate to be able to gather records for SURF1 in particular. So we actually started this partnership before Cure Mito was Cure Mito, when it was focused specifically on SURF1. And so we have a cohort that we were able to collect data on with SURF1 related Leigh syndrome. And I'm excited to share a little bit about what we found today. So as part of our commitment to our patients, we always want to share back information we learn from patient records. So we were able to gather some information from these records and structure it. In time, the goal is that we will fairly soon actually be sharing that information with Cure Mito directly to share out to the community. So today is a little bit of a sneak peek at what we've been learning. So who is in this SURF1 cohort? Patients who had diagnostic genetic testing confirming Leigh syndrome caused by SURF1 deficiency in their records. So, in patient records, we're usually able to get those genetic testing results that allow us to confirm that the patient really has a diagnosis. We're focusing here on patients that were located in the United States. And who is excluded? So one of the processes that we go through when we onboard new patients is that we want to make sure we're including folks in our work for whom we're able to collect a sufficient breadth and depth of medical records, so that we're not leaving big gaps in the story of their journey. So anyone who didn't pass those steps because we weren't able to get sufficient records wouldn't be included in these in the data here. So here's a demographic summary. This is data on 15 patients in this SURF1 cohort. The breakdown of male to female was 9 females, so 60% of the cohort, 6 males, 40%. The median age was 7. These are all patients located within the US, and you can see the age range broken down on the right. Largest number of patients between ages 6 and 7. We have kind of a big grouping between 4 and 11 years old, and then a handful of patients that are 16 and older. So as I was saying earlier, part of our process is that our team goes out and requests the medical records for these patients after they've signed the HIPAA forms to allow us to do so. So we were able to gather more than 3,700 medical records across these 15 patients. That's a median of 220 records per patient. These folks had a median of 5 healthcare facilities that we were collecting records for, and a median of about 6.5 years of records per patient. Here you can see the breakdown of the types of documents that we're getting. So we're requesting all kinds of things. We're getting some of the data that we're especially interested in is coming from those really rich descriptions in specialist or primary care physician notes, records from hospitalizations like inpatient stays or ER visits, labs, etc. Here, this is just focusing on what types of specialists are we seeing most commonly. Not surprisingly, all the patients that we included in these 15 had seen genetics and neurology. And then you can see going down slightly less common, but still pretty common, cardiology, general practitioner, ophthalmology, physical therapy, and so on. So in terms of age of diagnosis, this is diagnosis confirmed by genetic testing. The age at which that was happening for patients varied. And the most common age range in which folks were diagnosed was between 2 and 3 years of age. But we had some folks who were diagnosed much younger than that, and then folks who were diagnosed 10 years old and beyond. The median age of diagnosis was 2.5 years. And then the years in which those diagnoses were happening were variable as well. We had the most patients in this group were diagnosed between 2018 and 2019. This data was collected up through about mid-2021. So that bar on the far right with 2020 and 2021 probably would have been higher had we had ongoing data collection included here. And then we even had a handful of patients who were diagnosed prior to 2013. One of the things I'm always interested in coming out of data from a new cohort is what the symptoms breakdown looks like. So one of the things we're interested in is how are patients presenting? What are the first symptoms we're seeing? This largely aligned with what we saw in medical literature. So vomiting and feeding problems were a common first indicator, first symptom of Leigh syndrome here. Similarly, growth issues, so failure to thrive or short stature, slightly less common, but still common for symptoms are hypotonia, sometimes called like being a floppy baby, for example, lactic acidosis, indicators of cognitive impairment or developmental delays, and then movement disorders or movement abnormalities. You'll see these add up to more than 100, and that's because some of these patients did have coincident symptoms. The median age of symptom onset was 1.5 years, which is interesting because it's about a year behind where the median age of diagnosis is. So, and this graph is showing symptoms that were present in patients' records at any time. So not first symptom, but just was a symptom present in the patient's record, period. Of course, these symptoms have different median ages of onset. So some of the variability could be related to the fact that not every patient in our cohort may be at an age where we'd expect them to be manifesting certain symptoms. But given that, the most common symptoms we saw, again, not huge surprises here. Hypotonia was really common. Movement disorders or gait abnormalities, second most common. Cognitive impairment, developmental delays and regression, also pretty prevalent. One of the things that we often look at in real world evidence, because it can help serve as a proxy for things like disease progression and other interesting endpoints, are what kinds of assistive devices are folks using. So all 15 of the patients that we included here are using assistive devices. The most common one that we saw in the records were braces. Those were used by 73% of patients. And of those brace-like devices, ankle foot orthoses were the ones that we saw most commonly. You'll also see, so standers were another common one at a little over half the cohort. And then other is the next most common category. That was a catch-all for a whole bunch of things that were kind of a mishmash and included things like communication devices, seating systems, feeding devices, and so on. So one thing I thought was really interesting here is that the median number of assistive devices documented in the record was 7, which is a fairly high number. So that is just, again, a sort of a sneak peek at some of the insights we're hoping to share back with the community quite soon. Some of the things I thought were really interesting here were just the number of facilities that folks are receiving care at. I mean, I think it really kind of gets to what I imagine is a challenge in finding specialists who are knowledgeable about the condition and capable of managing it. There's also, there was a notable gap between that median age of symptom onset, 1.4 years, and the median age of diagnosis at 2.5 years, which was making me think about that diagnostic journey that I'm sure lots of folks are undergoing. Some of the common symptoms that we saw here were generally aligned with what was in the medical record, so we didn't have any huge surprises there. Our median age of onset looked a little later than some of what I saw in the literature, but again, this is also a small cohort, so that's not necessarily a huge surprise. And then just the fact that patients are using lots of assistive devices, which to me has me wondering if there are opportunities out there for research to better understand the benefit that families are deriving there. So our next steps, as I mentioned earlier, we're going to be preparing these insights to share back with CureMido that can then share them out to the larger community. There will be some additional information beyond what I've included here. And this data that we've been able to collect to date, we're hoping to be able to contribute to future research should the opportunity arise. And I just want to thank Curmito and also the amazing families that have participated and shared their information in order to contribute to this research. We are so grateful for the opportunity to partner with you. And I think there's going to be a question period after this, so I'll hold off on asking for questions and pass it back to Danielle.
Actually, thank you very much. That was really fascinating, especially given what I know from the Curmito registry and some of the analysis that we've done. And then also as a mom of a kid with a rare seizure disorder, one thing that jumps out at me, and it's time for Q&A, so I'm just going to ask my question to you. One thing that jumps out at me with your list of early symptoms is that those could also be early symptoms for a lot of things, right? Hypotonia, vomiting, feeding issues. And it really strikes me how challenging it is to get a diagnosis when that is how your child is presenting, right? Because, so I think, well, I'll ask you, is that why the push for genetic testing when you start to develop, developmental delay is so important? I know that I have another child with had a developmental delay, and probably because of my older son, but not necessarily. I noticed a change where the pediatrician said, let's get a genetic test. So I wonder if that's something that you're seeing, and what are your thoughts around that?
Yeah, oh, what a great question. So I don't think I said this off at the top, but I trained as a genetic counselor, so I've seen patients in clinic in that setting a lot too. And a thing that is like kind of striking to me when I look at our data across lots of conditions is how that age of diagnosis shifts over time, because you can see the trend. I'm making an assumption here, but I think that access to genetic testing, broader genetic testing earlier, is like part of the reason for that shift that we see. And certainly I hope that the trend over time for this cohort too is to see that gap in the median age of symptom onset and the median age of diagnosis shrink and shrink and shrink.
Mm-hmm.
And I'm biased as a genetic counselor, but I hope genetic testing plays an important role in that for sure.
Thank you. Yeah, me too. And I always tell people they're concerned about a delay. Of course, I'm the lady they all ask, because of my kids. And I always say, ask for a genetic test. Even if you don't have a family history, ask for a genetic test. And yeah, I think that message is getting out there thanks to groups like Curmito. I have a question from Brian. Has All Stripes had a change to engage with the FDA or other health authorities on how this patient shared data is viewed for patient burden journey, external control, a chance to engage with the FDA for patient burden journey, external control, natural history, et cetera?
Yeah, that's a great question. We have been fortunate to be able to meet with the FDA, and we're always on a quest to learn how to best support the endeavors to get treatments, to get them faster. So talking to the FDA is an important way to do that. And then we're working with partners as well who are engaging with the FDA, and so learning lots through them as well.
Great. And Devin Sherman in the audience says, as another genetic counselor, I definitely second that bias and recommendation.
Yeah, go genetic counselors.
I'm really glad to hear that, though. I think that's a really important thing, that an easy thing for parents to advocate for. Let me check the Q&A real quick, and then we'll go to a break. Does signing up to Curmito registry allow to transfer our data to other databases mentioned today, meaning All Stripes and RDCA DAP, or should we register to all of them? Sophia, maybe that's something you can answer.
Sure. Yeah, no, Curmito patient-reported data with courts, that's separate from All Stripes. So there are two separate registrations, although we would like to combine the data, but you have to register in both. Regarding RDCA DAP, you don't need to register. It's a platform where we would share a whole data set. Individual patients don't need to register, and we would share the identified information, so your name wouldn't be shared with them. I hope that helps.